Hello, my name is Alexis Hibbert, and I'll be presenting on canine parvovirus, also known as CPV. This presentation will cover infectious agents, symptoms, transmission, treatment history, testing, and a couple of other things as well. So canine parvovirus, or CPV type 2, is a highly contagious virus that affects all dogs, but especially puppies. It belongs to the genus Parvovirus under the subgenus Protoparvovirus and is part of the Parvoviridae family. What makes CPV unique is it's a non-enveloped, single-stranded DNA virus. So although its exact origin isn't fully known, researchers do believe that it evolved from a virus called feline panleukopenia virus. This virus shows very similar symptoms to parvo, but it's only found in cats. So CPV targets the rapidly dividing cells in the small intestines, especially in the crypt epithelium. So what this results in is tissue damage, including epithelial necrosis and villus atrophy. So these changes basically impair the gut's function to absorb nutrients as well as to maintain their barrier functions. This results in clinical symptoms such as anorexia, lethargy, vomiting, and diarrhea. In some cases, we'll see hemorrhagic diarrhea, so you'll see blood in the diarrhea. Generally, when we start to see this, we're realizing that we have a really sick dog. The virus is shed in feces of infected dogs, and this can begin just a few days after exposure. The shedding can continue for up to 10 days after the dog appears to have recovered, so after symptoms have subsided. Transmission occurs either directly, so this would be through oral or nasal contact with infected feces, or indirectly through contaminated objects and surfaces, so this would be known as fomites. Fomites can include bedding, food bowls, shoes, or even your hands if you've been handling parvo-positive dogs. Treatment for CPV is largely supportive. So just like in humans, viruses in dogs are a lot more difficult to deal with. It's not like we can just throw antibiotics at it and that will be enough. For that reason, we do supportive care, so because there are no antiviral cures. Supportive care will generally involve fluids and electrolyte therapy, nutritional support, anti-nausea medication, and antibiotics. The antibiotics are to protect the compromised gut, just to avoid secondary infection in that area. Interestingly enough, they actually started doing fecal microbiota transplants, which they've done more and more now too in human medicine. This is where they use healthy feces from a donor dog and do a transplant. These transplants have shown promise in reducing the duration of the diarrhea as well as hospitalization time. So with proper treatment, survival rates for parvo are really high now. They used to be a lot lower, but now that we kind of know what we're dealing with, they range from 70% to 90%. So the plus side as well is that dogs that recover usually will develop long-lasting, this can even be lifelong immunity to the parvovirus. CPV, it first appeared in 1978 in regions including the United States, Europe, Asia, and Australia. It's likely that it emerged, like I said before, from a mutation of the feline panleukopenia virus. Basically, the virus just adapted to be able to infect dogs as well, not just the cats. So after this, the virus spread really rapidly. It became a global issue in less than 2 years. But thankfully, by 1981, a vaccine was developed, and that still remains the foundation of prevention efforts today. After infection, CPV initially will replicate in the lymph node tissue, so it's located in the oropharynx. From there, the virus will spread throughout the bloodstream, leading to systemic illness. So this widespread distribution is why we see symptoms that often affect multiple body systems, even though a lot of the symptoms are specific to the gastrointestinal tract. So there are several ways to test for CPV. The most common include PCR testing of feces, as well as electron microscopy and viral isolation techniques. There are also other forms of testing which look for antibodies in the blood. So a fourfold increase in IgG over a 14-day period, or the presence of IgM in an unvaccinated animal can confirm that there was a recent infection. However, we don't generally use those tests in a clinical setting because by the time we get the results back, we're already treating the patient. So to wrap up, canine parvovirus is dangerous and highly contagious. Early detection and aggressive supportive care are, I don't want to say vital, but I would say, depending on the patient, pretty necessary for survival. The older the patient is, the higher likelihood that they will survive the virus without supportive care. But a lot of the time, if they're not hospitalized, they at least need like subcutaneous fluids at home. So novel therapies, thankfully, like fecal transplants, are starting to show promise, but vaccinations remain still the best form of prevention and will probably continue to be the best form of prevention. So that is it. Here is my sources cited. Thank you so much for your attention.